Good evening. Welcome to the Highland Falls for Montgomery Central School District Reopening 2020-2021 Town Hall. I'm Dr. Frank Sheboy, Superintendent of Schools, and I'm joined by Dr. Andrea Tejador, our Assistant Superintendent for Curriculum, Instruction, and Technology. And I just want to take a moment to thank you all for being here tonight. I also want to thank Stephen Klein for his organizational work and making this possible for the evening. So as we talk about our reopening or our proposed and planned reopening, we want to discuss the elements of the district's reopening plan. There's 7 elements that we considered: our response and planning for the 2020-21 school year, a comprehensive informed approach, how we reopen all of our school buildings, our proposed instructional models, support for our school community, our communication, and our final preparations. We'll begin with our response and planning for the 2020-21 school year. If we take a look back in time, the past 6 months, we all know what happened in March. March 1st, we had the first confirmed case. March 5th, the district distributed hygiene guidelines to the community. March 13th, County Executive Steve Newhouse closed schools. March 16th, Governor Cuomo closed our schools. March 17th, we began our distribution of meals for our community. March 20th, the governor extended the closure with an executive order called New York State on Pause, and we began our Chromebook distribution for any child who didn't have one personally. The 27th, again, an extended closure for all pre-K schools, pre-K through 12 schools in New York State until April 15th. April 2nd, the governor extended that closure to the end of April. We moved right along. April 3rd, we distributed district distance learning guidelines. As we moved right through in April of 2020, April 15th, the New York State Board of Regents released guidance on Regents exams, and those exams were canceled. In May, the governor announced that our schools would remain closed for all of last year. And in May, we continued our budget process. In June and July, the district began its planning with advisory committees. Operation Reopen Teaching and Learning Advisory began its work on June 10th. The community approved its school budget and elects new board members on the 15th. The 26th, we celebrated the class of 2020. July 2nd, the Town of Highlands Recreation Department began to feed our children. July 8th, the governor set a deadline for the state at the end of the first week of August for reopening guidance. July 13th, the Board of Regents met and released a framework on planning and directed New York State Education Department to provide guidance by the 15th. On the 16th, New York State released that guidance. And on the 27th, tonight, we have our first virtual town hall. As we've done throughout this entire process, we have taken a comprehensive, informed approach to this program. We're looking at information from the New York State Department of Health, as well as the Centers for Disease Control and Prevention, and the guidance for how to reopen schools. In addition, we're looking at the governor's reopening plan to make sure that all that we do is in alignment with it. And lastly, the New York State Department of Education guidance. We have approximately 145-page guidebook on how to reopen our schools. The guidance and portal timelines, we had our guidance, it was actually the 16th, it was due on the 15th, but that was issued to school districts. On the 17th, the portal where districts would submit their assurances to meeting all of the requirement in the plan opened up, and those submission for the submission through the portal will be on the 31st. We began in June with some stakeholder surveys, and what we did was we asked for information regarding schoolwork attendance, transportation, and potential barriers to working in either a physical or virtual environment. We had 92 staff and faculty responses, 312 families, and 269 students. Overwhelmingly, our families felt that they would participate in a hybrid model where their child would come to school for a portion of their instructional time, but receive the remainder of the instruction through a virtual or online platform. We did have some that said, regardless of what type of platform they would choose, an alternative program. And that's same information for secondary. As we began to figure out how we're going to reopen our schools, we were guided by some very simple principles. One, which we've had since February and March, was to ensure the safety and wellness of our students, faculty, and staff. Second is to deliver high quality instruction to students regardless of the delivery model. Third, to be flexible to the ever-changing conditions and be responsive to student needs. And fourth, to plan for progress, not perfection. Section 3 will talk about reopening our school buildings. We wanted to take a look at the student and staff experience. It's important for us to consider this in all of our plans. So we looked at teaching and learning, social, emotional learning, our vulnerable student populations, including our special education children, including all students who are new to a new grade building or a new grade band. We looked at transportation concerns, our facilities, food services and how we're going to meet the nutritional needs of our children, health and wellness, the unique needs of our English language learners, and security and safety within our buildings. We looked at the best practices as recommended by the CDC as well as the Federal Department of Education, which included limited traffic hallways, daily health screening, distanced workstation, reduced classroom seating, sanitation stations throughout our facilities, avoiding sharing of equipment, virtual meetings and classroom when necessary, and PPE and increased sanitation. Following some simple steps, we've placed posters and flyers and signs throughout our buildings reminding people of the need for masks, the need for social distancing, the proper way to wear their masks, and appropriate hygiene. The district has spent the last 4 months in acquiring PPE and materials. So the district has bought approximately 40,000 masks, including washable ones for faculty and staff and disposable ones for faculty and staff and students who may have a need. We have plastic or rubber gloves, as well as latex-free gloves for students who have, and students, faculty, and staff who may have allergies. We have sanitizer dispensers in all of our buildings, disinfecting machines so that we can meet the disinfecting needs of all of our classrooms in a more efficient manner. HEPA filters, we immediately, upon closure, changed all the filters in all of our learning spaces and our offices in our buildings and have moved to a 3-month replacement cycle on those. And we have tissue boxes for our students, faculty, and staff. The district's preparation for health and safety. We plan on providing a health screening questionnaire for all students and staff every day when they enter the building. This has been implemented already for our faculty and staff. As far as temperature screening, everyone should check their temperature at home prior to leaving for school or for work. In addition, the district has installed thermal scan devices at the entrances to the buildings. We will be limiting access somewhat to all of anybody who's not a student or faculty or staff member. Appointments would be necessary to meet with administrators or guidance. We want to remember this is a school, but we have to keep everyone safe. Physical distancing, sometimes referred to as social distancing, is encouraged in all spaces, even when masks are worn. The CDC recommends 6 feet, and that's what we've been recommending. No supply sharing. We have limited the school supplies that are shared, so we have bought additional supplies for our offices and for our faculty and staff. Face coverings, I alluded to already, but they will be required for faculty and staff as well as for students. We will provide them to faculty and staff and to any student who may need them. Hand sanitizer will be provided with hand sanitizing stations in the classrooms as well as in the hallways. We also have soap and soap dispensers in our lavatories. Training students and staff, we must provide training for COVID-19 prevention practices, including social distancing and face cover usage. We have signage and ongoing communication will supplement and reinforce that training. As far as issued devices, the district will continue to provide Chromebooks to students as needed. And for new students, have no fear, we will make sure that they get their Chromebooks as well. Hand washing will be encouraged throughout the day and required before and after meals. Food services, families will be encouraged to send their children to school with lunch. However, we will also provide the school lunches through Aramark, our contractor. We'll be using individually wrapped portions, reinforcing hands washing and sanitizing, disinfecting surfaces, no sharing of food, no more communal foods, and minimizing the use of our cafeteria facilities. As far as transportation, we are working with our transportation partner, West Point Tours, to limit the number of passengers on all general education buses in accordance with current public health guidelines and encourage family to transport their children. As far as cleaning goes, we will maintain a cleaning schedule for all of our schools, our facilities, and with our partner, West Point Tours, all of our buses. The classroom environment. We will be working to manage class size to maximize social distancing. We will be requiring face coverings for our student and staff. We're looking at models for cohorts of students to minimize exposure and to allow for contact tracing. We're creating in-classroom meal service options to reduce exposure, designating hand washing breaks throughout the school day, especially in our elementary classrooms, removing and minimizing non-essential shared items from the classrooms, and creatively repurposing or looking at repurposing alternate spaces such as cafeterias, gyms, library media centers, auditoriums for instructional use. And we will encourage the use of digital resources for our instruction. Some of the bus transportation considerations that we have been examining are requiring face coverings for students and staff on the bus, modifying bus routes to accommodate reduced occupancy, intensifying the cleaning protocols for transportation, so between runs and after each day, evaluating options for screening and requirement for face coverings. And again, as we had indicated, temperature screening prior to children leaving their homes is going to be the expectation, and encouraging social distancing at pickup and drop-off points. Adapting our student meal service. Our goal will be to minimize crowds by deploying alternate meal service options, provide grab-and-go meals to be eaten in the classrooms, designing classroom delivery models for our younger children, using signage and social distancing strategies in the cafeteria, adjusting the lunch service options to utilize alternative space for meal consumption, adopting a cashless, touchless point of sale transaction system for the cafeteria service line. We need to minimize the handoff of money and things such as that, and maximizing social distancing as much as possible. Before and after school care and our extracurricular activities and our athletics. Again, a phased approach for participation in activities and athletic programs. Monitor and following guidance from the New York State Public High School Athletic Association. Conducting extracurricular activities virtually whenever possible. We know that our extracurricular programs are vital to students, not just to get into college and for opportunities such as that, but for the socialization and the interest building that they provide. And establishing sanitation procedures for all shared equipment. We'll continue to work with our partners to evaluate before and after school program models to accommodate needs. And we work with the Healthy Kids program, and we expect to continue to do so moving into the 2020-21 school year. This time I'll turn the presentation over to Dr. Tejedor for a discussion of proposed instructional models.
Thank you. It's a pleasure to be here this evening to see all the work related to instructional models.
Can you hear me now? Yeah, I can hear it. Okay.
Okay, thank you for your patience while we got the presentation where we need to be and volume corrected. It's a pleasure to be here tonight to talk about the different instructional models that we have been working on. Again, all of our models are based on the health and well-being of our children and the best way to return to school. We have prepared for multiple scenarios in parallel if the need be, looking at preserving in-school instruction whenever possible, providing a virtual learning option, addressing students' academic, emotional, and social needs, and minimizing health risks while at school. Also recognizing the need to pivot with agility in the event that we need to go to a virtual learning environment right away. We have prepared 3 hybrid models that I will share with you this evening. In the 3 models, students will attend school in person some days and virtually other days. Establish an online daily attendance structure. Students attend school online during regular school hours and follow a standard school schedule. Teachers will use a hybrid model approach. Teachers meet with students daily utilizing Google Meet. Based on the surveys that we originally administered in June, we heard the need for an increase in synchronous structure. Therefore, all of the models that we have that I'll share with you this evening do include additional time for synchronous instruction. Schools will employ physical distancing measures, meeting established thresholds where possible. In-person class sizes will be reduced, and schools will have to account for specialized classroom space needs for students with disabilities, and vulnerable student populations will be prioritized. The first hybrid model that I'll be sharing with you this evening is an alternate day AB schedule for in-person learning. The way this is set up, there will be 2 groups of students, Group A and Group B. On Mondays and Thursdays, Group A would be in school, and on Tuesdays and Fridays, they would be receiving instruction virtually. Group B would be virtual on Mondays and Thursdays, and Tuesdays and Fridays they would be in school. Wednesdays are reserved for virtual meetings with small groups of students, parent and staff outreach. There's several advantages to this model, including that students would have live interaction each week. There would be opportunities for English language learners to be in English-speaking classrooms. We would utilize a flipped learning approach by sharing materials in advance of class. Scheduling and planning would be an advantage. We would be able to group the students and schedule them together, able to maintain contact with students, monitoring their progress face-to-face, and younger students would have a nice balance of screen time. There are also disadvantages. How does a teacher plan for both types of sessions? There's family need for childcare, which that unfortunately is a disadvantage in all 3 models. A great need for creative scheduling and lesson planning, lack of consistent face-to-face engagement, parental support on virtual days, concerns over who would be supervising the children. Every other day is difficult to build relationships, teacher preparation and lesson planning, time for both models, difficult for students who need routines and need time to chunk the standards. The second hybrid model looks at a full week rotating schedule where there are, again, 2 groups of students, A and B, but students would be rotating based on a week rather than a day. So for instance, Group A would be in school 1 week on Monday, Tuesday, Thursday, and Friday. That same week, Group B would be virtual. The following week, Group A would be fully virtual, and Group B would be in school for the 4 days. Wednesday, again, would be virtual for all students, and small groups of students would meet, and it'd also be time for parent and student outreach. The advantages is that there is a benefit to consistency of days in the model, all in school or all virtual for that week. You get a block of time with the teacher, which may make planning easier, and you may help some students that need social and emotional time, a greater block for that. Disadvantages, again, that family need for childcare. How would families be able to meet the hardship of that on-off scheduling? It may be confusing for parents which week does the student come to school, and the potential lack of engagement for the virtual week. In the third hybrid model, we are looking at the 2-day block schedule for AABB for in-person learning. So again, we have 2 groups of students, Group A and Group B. Group A would be in school on Mondays and Tuesdays, and then virtual on Thursday and Friday. And Group B would be the reverse, virtual on Monday and Tuesday, and in school on Thursday and Friday. Again, reserving Wednesday for virtual for all students, pulling small groups of students together online, and also for parent and student outreach. Very similar advantages and disadvantages to the first hybrid model. One of the advantages is consistency for a 2-day period, and a disadvantage, again, the need for childcare. How does a teacher plan for both types of sessions? Parental support, lack of consistent face-to-face engagement. Every other day, difficult to build relationships. Well, this one, it's the end of the week or the beginning of the week, there would be less consistent time with the teacher. Difficult for students who need routines, and the need to check the standards again. And then the final model I will be sharing this evening is a 100% virtual model. You'll see that we have students Group A, Group B, 100% virtual all days. Advantages to this model is that it's consistent. Student experiences would be uninterrupted should we need to suddenly close due to COVID. It's our most flexible model. It eliminates classroom exposure to COVID, and it also allows us to build the digital capacity of students. Some of the disadvantages is the potential impact on our students in career and technical education programs, the social and emotional learning isolation that our students might experience. Also, the difference of experience for new students and new teachers. All students do need a face-to-face experience. In this model with virtual learning, we would be building in significant synchronous time for the students to have face-to-face learning with their teachers. Student supervision and support is not as robust. There's a high need for parent involvement, especially in the lower grades, and it's difficult for many students with special needs or with limited English proficiency. So now we're going to look at support for our school community. One of the areas that we focused on since we left school on March 13th was professional development training for our faculty. We started the following week with intensive professional learning opportunities for the faculty to learn best practices for remote instruction. We started that and we continued that through early June, where we offered professional learning opportunities for all staff and faculty on the different types of technology the district uses, and also on best pedagogy related to teaching in these learning environments. This has continued over the summer with intensive related to literacy development, math development, and also, again, the need to design virtual learning environments, how to make personal connections in virtual learning environments, and also how to use tools to create learning opportunities when students are not with the instructor. These are some of the types of training that we will be continuing to offer or that we will be putting in place as we move into this new school year. Looking at implicit bias training, responding to COVID-related employee concerns, student health protocols for screening, transitions, and social distancing, teacher, student, and family training for all implemented health and safety protocols, teacher, student, and family training for all implemented teaching and learning protocols, supporting student and employee mental health, effective family communication strategies for schools, building an equity-centered social emotional learning program, strategies to support social and emotional learning, training on grading and attendance, best practices in virtual learning environments, and creating structures for hybrid learning. In order to accommodate the need for professional development, we have modified the school calendar to include 4 days of superintendent's conference days on September 1st, 2nd, 3rd, and 4th, anticipating students' arrival on September 8th.
So over the past 2 weeks, we had a email set up, reopening at HFFMCSD.org. We received approximately 50 questions through that portal. We were very happy to get those. We believe we've addressed a number of them through the presentation, but we have about 20 or 21 to go through with you. So we're going to take a few minutes to do that now. First question: are you going to continue to push band and have kids rent instruments so that we don't know have been sanitized? We're actually going to continue to push all of our programs. We recognize the importance of the arts and arts instruction for the social and emotional development of our children. Plus, it gives them an opportunity to compete at different levels. We will work with our partners to make sure that sanitation protocols meet or exceed that of New York State Department of Health and the Centers for Disease Control.
There we go. I think we're good, right? Yes. With scheduling, we are looking to reduce the time for students to be on devices for extended periods. And we are hopeful that with the increased time for synchronous instruction, that students will have less time at the end of the day on their devices. The next question we had was, given the current circumstances, are we considering going brick and mortar at all? Currently, we are focusing on a hybrid model that will bring students back to brick and mortar on alternating days.
We received a question regarding a concern that word in the town is that we do not plan to open brick and mortar in September, that instead we're going to be starting virtual with the possibility of potentially returning in January as a maybe. We actually are continuing to develop our plans. Right now we're waiting for guidance from Governor Cuomo, but that is not our plan to begin in January as a maybe. Our goal would be, to the extent that is practicable, to get some of our kids back returning on a phase-in basis as soon as practicable and safe. The next question was, at the time of submission of these questions, I understand you're waiting for the governor, and we think we will know the first week of August. Are you prepared to give families an answer on what way the district will go immediately after his announcement? I would say we're prepared to give families an answer very soon after. I wouldn't say if he gives it to us on Friday at 5 p.m. that we would give it to you at Friday at 5:04 p.m., but we certainly would before the middle of the following week. We have some pretty good ideas of direction, but we do need that guidance from the governor in order to make a final plan.
And the next question, how do you plan to do virtual schooling? Are you making changes to the program at all? Are you training teachers to do virtual learning? As I indicated, the superintendent's conference day at the we'll be starting our school day with 4 superintendent's conference days, and we have had professional development related to the need for instruction in remote environments, and we'll continue to build on that as we move into September and continuing throughout the school year again.
The next question asked if we were considering bringing back juniors and or seniors, or just the seniors, to have some sort of normal for their last year. Actually, our goal is to bring back all of our students. And what we will do when we begin to phase in our students is we will bring back our most vulnerable and the most challenged populations. As we had mentioned, we have a number of special education students that we would want to make sure we're meeting their needs, as well as the needs of ELLs, the needs of anybody who's in a new grade configuration or a new building. But our goal will be to bring back all of our students to some level of schooling, some level of normalcy based on the guidance and the direction that we receive from New York State and conditions of health and the virus on the ground. The next question at this time, oh, actually, I just addressed that. So at this time, again, we are looking at bringing back different configurations.
So the next question, will the parents get a chance to provide input to the options other than the survey which that we administered previously? So now that we have had a chance to share the different models, the different hybrid models, and also the virtual model, we will be posting a survey to gather feedback on our website tomorrow, and we'll send out an announcement. And the purpose of the survey is to get feedback on the 4 instructional models that were presented this evening.
The next question was, what are the criteria and conditions to revert back to normal? And I think that's a very difficult question for us to answer because until the virus is truly at bay, there won't be normal. We will still be socially distancing, which means that we will have fewer children in our classrooms. We will still need, in all likelihood, to wear PPE and masks. Normal is predicated by a lot of factors that are beyond anything that the school district's in control of. So we will, again, be mindful of directions from the CDC, the Department of Health, the infection rates in the region, and that's what we'll use to figure out if we can get back to our next normal. We had a question that asks, what is the district doing with the money that's saved from having a hybrid program, including no pre-K, no clubs, limited travel, etc.? And I would say actually the district is spending a lot of money that is coming out of this year's budget on meeting the needs of students. So if we're moving from class size of 24 to 12 or 13, well, that's additional staff. We have to obviously hire additional cleaners to help make sure that we are disinfecting our classrooms and all of the touch points throughout the day to keep our children and our faculty and staff safe. The district is spending a lot of resources on PPE, again, including sanitizing solutions, masks, gloves, gowns, thermal scanners, all of the things that we discussed previously in regards to health and safety. It's not anticipated that the district is going to save money this year. It's actually anticipated that the district will likely spend more money on areas differently than what we had hoped.
On the next question, many districts have installed webcams in the classroom so that when students are not in school, they are attending class, maintaining synchronized learning routines, etc. Is the district implementing these measures? We're looking at several different models to inform our practice related to synchronous instruction, and we're in the process actively of exploring those different possibilities now.
We received a question that says, what is the percentage of classes that would not be able to socially distance if school was in full session? In other words, what is the maximum number of students per classroom? We did a walkthrough with our principals for every classroom space and every space in the district. And our typical classrooms range anywhere between 650 and 850 square feet. Based on the amount of space that is taken up by other student materials and desks and teacher desks and things such as that, we average probably in the vicinity of 11 to 14 students per classroom if we're going to socially distance. So given that we would, we don't have many classes that would not be able to socially distance without using spaces such as the auditorium or the gymnasiums, the library media centers, or other spaces such as that. So.
Okay, the next question. When the virtual learning happened in the spring, the teachers already knew the students, their strengths and weaknesses, and their behaviors. With a hybrid model, this will be much more difficult for the teachers to establish a rapport and truly understand the children. What is the plan to mitigate against this and to improve the socialization and connectedness in the classroom? We plan to start the year really focused on the social and emotional well-being of our students. We're going to be looking at ensuring that the students have an understanding of what it means to use the technologies and how to focus on digital citizenship skills, what's appropriate behavior, and how can they really use the technologies that they have to support their lives as learners. And we will be looking at really focusing on how to connect to the students, where we'll be providing professional development on different ways the teachers can get to know the students, use in a distance learning environment, and making sure that we form those connections early on.
Our next question asks, what if a parent determines that the hybrid model is not working for their child and the home environment is not conducive to learning? What can be done to help the child? So our guidance staff, school psychologists, and social workers will reach out to students and families, in addition to our administrators and the faculty and staff, who may need support with skills to learn in these different environments. We know that this is a challenge, not only for our school district, but for every school district, as students become isolated or they become disengaged. So right out of the gate, we need to make sure that our faculty and staff is continually reaching out. And that's one advantage of having that Wednesday in the middle of the week for that type of outreach before somebody becomes disengaged, before we have a child who drops off the remote world, that we can continue to reach out and support the family. And there may be a need for some parental support. So Dr. Taylor at the end of this will speak about some parent university classes and things that we're going to be doing.
Yes. The next question, what training have the teachers had over the summer to improve the virtual learning? I've talked about many of those. We've also been focusing training on the different tools that are a part of the Google Suite. The functionality in Google Meet is being addressed over the summer by Google, and there'll be opportunities to have new tools to group students in small groups, like breakout rooms, and to be able to use the technology in a different way than it was available in the spring. So we're looking forward to that enhancement to Google Meet. In addition, we'll continue to run professional learning on the Google Suite and all of the other instructional tools that we have available.
The next question asks, if the governor allows for school districts in phase 4 to open in a hybrid model, fully open, or do all virtual, who makes the decision? Is it the school board, the administration? So it's a collaborative partnership between the Board of Education and the school and district administration. We work closely, and ultimately we will make that decision together as a team for what we believe is the best interest of all of our children.
The next question is, if students have a medical reason that prevents them from attending physical school during the pandemic, will they have other learning opportunities? Again, with the increased functionality in the Google Suite features, teachers will be using Google Classroom to post assignments, activities, and resources, and home instruction could be provided via Google Meet.
The next question says, is the state providing additional funding to the schools that choose to reopen in full or have a hybrid model for PPE, cleaning supplies, contact trace training and teams, special cleaning services, hand sanitizing, etc.? One word, no. The federal government has provided a small amount of money under the CARES Act. The district received approximately $150,000 of that. That does not go anywhere near meeting the needs that the school district has. The state also does not seem to have the money and the resources to support the schools in that. Anybody who would like to is certainly welcome. Please reach out to Congressman Maloney, Senator Schumer, Senator Gillibrand to encourage the next stimulus package to support schools and local communities directly.
The next question, what is the threshold for number of COVID positive student cases that will shut the school down to virtual only learning model? So if we have a student in the school that is identified as having been infected, we would need to follow all of the sanitization procedures as outlined by the Department of Health and New York State Education Department. Another part of that question is that the governor has established specific thresholds for regional cases. For instance, if the average daily infection rate of the novel coronavirus is 5% or less, schools in the region can reopen. If there's an average daily infection rate of the novel coronavirus at 9% or higher, schools in the region must close, and that would move us to a fully virtual model.
In the hybrid or full person model, will students be required to take COVID-19 tests prior to coming to school, and who pays that? No, students will not be required, nor will staff, to take COVID-19 test prior to coming to school. However, everyone who will be entering our facilities will be required to complete a COVID screening daily. Our expectation is that prior to sending their children to school, families will take their temperature and not send children to school if they're ill. Faculty and staff should not come to school if they're ill. All members of our learning community will need to complete that daily screening, self-reporting their status, so that we can keep everyone healthy and safe. The next question is related to that, and it asks, will the school nurse be allowed to send students home from school if they appear symptomatic? Yes, the school nurse can do that. And just to reiterate, our expectation is that families will not send their children to school if they're ill. It's also our expectation that families will provide an emergency contact so that any child who is ill can be picked up in less than 30 minutes. That's the only way that we'll be able to stop any potential spread of this, is to have children who are ill and faculty and staff who are ill stay home. And then if anybody is symptomatic or becomes symptomatic, to have them picked up from the building as soon as possible. The last question asks, how will fall sports be conducted this year? And when do they expect student athletes to be able to train as a team? So the New York State Public High School Athletic Association is the governing body for school athletics. They've been working on details regarding the athletic season for about the past 3 months. They've postponed the beginning of the fall season already to September 21st. There's question as to whether or not we'll be able to meet that goal of starting then. But the organization, the governing body, is the one who will make that decision. New York State Public High School Athletic Association is looking at a number of options in the event that we cannot play fall season in the fall, to still be able to have all 3 seasons play, perhaps at different times in the year than what we are usually accustomed to.
So one of the other questions that we did receive from the community was related to support and training for parents on the technologies that we will be using as we move into this upcoming school year. And we will be hosting parent university sessions online via Google Meet, and also at the Highland Falls Intermediate School, if it will be allowed, so that we can support parents as they need to support their children in this environment. We're moving into communications.
So next we'll discuss our elements for communications. So our goal is to reach out to people in as many means of communication as possible so that we don't miss an opportunity to engage. And like we have since the pandemic began, we'll be sending things out to our community stakeholders in both Spanish and English, including automated voice and email messaging to families and employees, social media posts on the various platforms, published editorials and handbooks, news coverage, a designated hotline and email as reopening at HFFMCSD.org, and a dedicated website or dedicated website on our district's website. The last area of tonight's presentation talks about some of our final preparations to get ready for a September opening. The key dates for summer begin tonight with our virtual town hall, where we've spent the last 45 minutes, probably another 10 or so, briefing our community on where we are in our planning. The instructional model survey is going to go out on the 29th and will be available through the end of business on the 31st. And we encourage everybody who's watching this to participate in that so we get good feedback. On the 30th, we'll provide a presentation to the Board of Education to inform the entire board as to where we are with our planning. Much of the same information that we're talking about tonight will be presented. On the 31st, the district has to submit its assurances to the State Education Department. In that assurances, we affirm that we are meeting all the requirements in that 125-page guidance document. We've also planned 2 more virtual town halls. Knowing that Mondays are hard for some people, we've scheduled the next one for next Tuesday. By then, we will submit our plan. We will open the board, and it's our hope that we can lay out more detail as to some of our thinking, and we encourage more questions at reopening@hffmcsd.org. August 7th, next Friday, we anticipate a decision by the governor on what we are allowed to do in regards to a return to school plan. The following Wednesday, we're having another virtual town hall based on what we hear from the governor so that we can put out a concrete set of information for our community. And finally, September 1st through 4th, our superintendent conference days will be presented in anticipation of our students' return to instruction on the 8th of September. As of the 27th of July, there are still many unknowns and many variables. Again, Dr. Taylor spoke of the metrics that the governor is holding us to insofar as opening or closing schools. But there's questions that we still have that we have not received information about parent choice. What we can do or what we must do for medically compromised students or teachers. And we'll be monitoring opening of schools throughout the country throughout the remainder of next month. We wish we could give you every answer tonight. We can't. And we'd rather not give you false hope that everything's going to be fine on September 8th. We want to be open and we want to be honest and we want to hear your feedback. So on behalf of myself, Dr. Theodore, and the Board of Education, I want to thank you for attending our virtual town hall tonight. Thank you. Be well and be safe.